Hi, my name is Shane Zumbrunnen. I'm an occupational therapist and certified hand therapist, as well as an owner of a private practice therapy clinic. We want you to keep in mind that you only have to test positive for one of the assessments in this series. You do not have to have all of the tests test positive in order for you to benefit from the kits that we have available to you. So let's do these tests together, pay close attention to your pain, and let's get started. Your rotator cuff includes 4 muscles that attach on the front of your shoulder, the top of your shoulder, and the back of your shoulder. The rotator cuff is responsible for helping us move in diagonal patterns throughout our arc of motion. And frequently, the most common point of pain is right here in the top of the shoulder. The bone that comes on top is called the acromion, and the tissue runs underneath this acromion and gets trapped between that bone and your arm bone called the humerus. We're going to show you 3 tests to help you diagnose your injury so that you know how to treat it with using our kits from Home Therapy Solutions. The first test that we're going to review is called the empty can test. The empty can test is very simple but is best performed with assistance from another individual. You will sit on a chair or on a table at home and you'll raise your arms up at a 45-degree angle away from your body. You'll turn your thumbs down and have the person assist you by putting slight pressure at your elbows in a downward fashion. If this motion causes you pain right in the top of your shoulder, this would be considered a positive test for rotator cuff tendonitis. The second test is called the Hawkins Test. The Hawkins Test is also a test for impingement and rotator cuff tendonitis. To perform this test, it's best if you sit in a chair and have an assistant to help you. You will raise your arm out at a 45-degree angle from the body, keeping your elbow bent at 90 degrees. Your assistant will support underneath your elbow while you relax and allow your arm to slowly move down through the arc of motion, with your assistant putting slight pressure on the back of your wrist. When you get to the end of that motion, if you feel pain in the top of your shoulder, that is a positive test for rotator cuff tendonitis. The last test that we're going to review is called the drop arm test. The drop arm test is simple to perform by yourself, but is best performed with assistance from another individual. You will bring your arm out at a 90-degree angle from your side. Your assistant will help you achieve that position and then will let go while you slowly lower your arm down to your side. If you have pain with this test in the top of your shoulder, that is a positive test for rotator cuff tendonitis. If you tested positive with any one of these tests, go to HomeTherapySolution.com before your symptoms worsen and order your kit today.